Okay, so y'all, let's get into it. So today is day one. We're going to talk about home births. What is significant about home births? I'm going to talk about some people that currently do it. And then I'm going to talk about, I'm not going to name any names, okay? Because that's not what I'm here to do. If I talk about generally about people, that's fine too, but it won't be any names. Okay, what am I doing here? I'm cleaning up my microblading, yeah. So y'all know that I got my lashes microbladed about 2 years ago. Now what I would like to do is kind of even it out a little bit, but so home births. What I want to focus on is who is eligible for home births, and kind of why I would not recommend home births for some, and who I wouldn't recommend it for. Okay. And I also want to talk about what goes wrong, and therefore what you would need in a hospital that is most not likely available at home. Okay, so why do a lot of people choose home births? They choose it because they may or may not trust the medical system. They may want to have a doula, a midwife, and just have the comforts of home. Now, ladies, what did you go through in order to have your baby? Let's talk about that. You had to find a partner, okay? You had to get your menstrual cycles together, okay? You had to think of all everything you had to put into getting right and tight for that man that you slept with to have this baby, okay? Cooking a baby, you know, having a baby, it takes at least 10 months, right? But actually it takes a little bit longer because all of the preparation to be right for delivery and for conception, you know, it may even start back to the first date. So just think about everything that you put into this, right? Okay, so we're going to go back to day one. Finding this beautiful man, choosing him possibly as a father to your children. So, you know, it may or may not have went like that, you know. We could all be positive and think the best, right? Okay, for letting you know, this is cream, moisturizing cream. This is Obagi. Okay, my esthetician uses it, but I actually got this one offline on Amazon. Don't tell her, okay? Always wipe up, ladies. Okay, home births. So let's say we've gotten to the point where we found this man. We may or may not be married, and we decide to have a child, or we find out we're pregnant. Okay, then what do we have to do? We have to get up and we have to go to our prenatal visits. We have to get multiple ultrasounds. We have to sit there and worry about whether or not we're gonna start bleeding. We're kind of even worried about infections. We're about, worried about any other man we possibly have slept with, right? Okay, because we know that every man that you've ever slept with, consider yourself to have slept with all the women that he slept with as well. Okay, so it's not only about you, right? It's about that man as well. So think about that. Now, what do we need in order to have this baby? We need ovaries, we need tubes, and we need a functioning uterus. Okay, hence our the title of our talk today. And we need a vagina, right? Unless you did IVF, you may be able to skip some of those parts. Okay, well, I'm putting on some mint gel that I got from the dollar store. Y'all don't tell nobody. Okay, so I've already put on moisturizer and I put on vitamin C. Okay, all right, now we're moving on to our SPF 50. Why? Because we got to keep it right and tight and it's hot outside. Okay, we got to avoid skin cancer. Okay, so we've done all of this to prepare for our child. Now we're pregnant. We have to go to our prenatal visits. And, even if, you have a midwife maybe that comes out to your home. Okay, well, I understand that. So let's say we've done all of this. We've gotten our ultrasounds. We've gotten our blood work. We've been tested for diabetes. We've been tested for, we've monitored our blood pressures. Okay, we've done everything we needed to do. We kept our weight 11 to 20 pounds or less. Depending upon if we were overweight or obese or whatnot, we may have had to go see the high-risk doctor. So let's start talking about people that do not need to deliver at home, right? So who is considered high risk? Anyone over the age of 35, okay? Anyone with high blood pressure before pregnancy or after pregnancy. Anyone who, anyone who had IVF, anyone who had a preterm delivery in their last pregnancy, anyone who had maybe 1, 2, or 3 miscarriages prior to your baby. Why would you why would you take, you don't want to take the chance of possibly something happening with this baby, right? With your baby once you get to labor and delivery. So, okay, so y'all, I'm about to put a base down, a base coat, which is always good. The only thing I don't have back here is water, because sometimes I'll put down water. But anyway, so, you've done all of this to prepare for your baby. And now, you had to choose a midwife. You had to choose a doula, okay? And I'm not knocking doulas. I'm not knocking midwives. I ask that you try to get one that you match with your personality, and you also want to get one who knows what they're talking about. So where are they certified? Look for the certifying agencies for doulas and midwives. Because why? Look at me. I am a board certified physician. I can go into later what that means, but that took a lot, right? So this is your baby, something that took 10 months. If we look at time in terms of in your uterus, 10 months, but I mean, it took years to find this man to make sure that he was possibly the one you wanted to have the child with. Think of all the emotions that you went through while you were, pregnant. Okay, so I mean, it's something to be taken seriously. Okay, we put down our base coat. One thing I didn't do was spruce out my lashes, so we're gonna do that. Okay. Okay, I'm back. So we've done all of this. Now let's say we come to full term. When is full term? Full term is 37 weeks or greater. Okay, anything less than that is considered a premature baby. Okay, and so some hospitals are not even certified to take care of babies that are less than 35 weeks. Some are not certified to take care of babies that are less than 32 weeks. So know which hospital you're going to. If you have a midwife and you decide to do a home birth, then they need to have a relationship at least with the physician. Why is that important? Okay, we didn't put a base on. Today I think I'm going to go with a pink in the middle and possibly brown on the corners. Okay. No, I think I'm gonna keep it natural. So we're gonna go with it like a gold. Okay, so you've now you've made it to the point where you are there. You're 38 weeks, you're 39 weeks, and your water breaks. Okay, you call your midwife and you say, hey, I'm in labor. Let's hope they're available and they're not with another patient, right? Okay, so when your water breaks, what does that mean? So, the barometric pressure. So let's say outside when you have a humid day, we just know that labor and delivery is going to be full because apparently because of the increased pressure in the atmosphere, it can, we didn't learn this in the books, but we see it, what's the word I'm looking for? We see it on labor and delivery, is that a lot of people will come in and they'll feel a pop and their water will break. Okay, so that's not necessarily in the books, but it's something that we notice on labor and delivery. You come in, your water breaks. Do not sit at home all day. Okay, do not wait to call your midwife if you have chosen a home birth. Okay, I would say immediately is good. Come right on in, start making your way in. Okay, get your ride together. You should already had a plan of who's going to take you to the hospital, right? So get that together. Make sure that is in the works. Okay, we've put our base coat on. We put a brown, then we're going to go to a darker. You always put your darker colors in here. Okay, so you've called your midwife. You've let them know that your water broke. Now, are you GBS positive? Now, this is another reason why you don't need to be delivering at home if you're GBS positive. Why? Because group beta strep, which is GBS, which remember they did a swab in your vagina and in your anus, can cause meningitis, pneumonia, and many diseases within a newborn. So you need penicillin, and we run that via IV. Okay, we run that via IV. In the hospital. Now, can your midwife run that at home? Possibly, if they're, trained in IV and they have medicine on board. I don't know. I don't really I'm not a huge advocate of home births, but you know, everyone's different. Can they do that at home? Sure, if they have that, but I don't recommend it because look, something could happen to your baby. Okay, so let's say if a situation where your baby has meningitis or your baby has pneumonia or something and they're born with that, then we automatically keep your baby in the hospital for 48 hours if they didn't get adequate treatment, right? So I don't have it in front of me, but I want to do my eyeliner. So y'all just bear with me, okay? Bear with me. I will do that here in a second. Let's see, what color do we want on our lips? A red, a pink, and a brown lippy. Those are really my, or a sometime a blush with a brown undertone or our outline is what I do. But I think today, let me just look at some of them while I'm talking. Okay, so let's fast forward to delivering. Those things that can go wrong that you need intervention, okay? During the labor process, we monitor the heart rate, correct? If the heart rate goes down, then some of the things you've seen us do, if you've seen us start oxygen, or some of the things we will do. We'll start oxygen. We will put you on all fours. We may rotate you to the left or the right because you have you on the left side, so it's probably switched around in this video. You have the connection from your heart to your lower body into your uterus, and so as that blood goes, that's the particular one that comes back up from your uterus. If it's blocked, okay, then you can possibly reduce blood flow to the baby, okay? So that's why we're turning you often, or to the uterus. And your midwife, of course, I'm sure will know that as well. But y'all just keep it. Let's say that does happen, or let's say we just can't get the heart rate up, okay? Let's say there's a clot, or let's say for whatever reason the baby, there's signs of distress. Do you want to be at home? Because your midwife is not doing a stat C-section, right? And stat C-sections do happen. Sometimes you can have an abruption, meaning that your placenta tears off. Remember that the placenta is the only blood supply to the baby, okay? Or babies don't actually breathe, so they need the oxygen from mom, okay? They need oxygen from mom. And if they're unable to get that, then you know we can't restore that source. Then we have to go back for a C-section, and you have to be in the hospital for that, ladies. Okay, we can rush you back, and we're trained as board certified OBGYNs. I can get a baby out. Most OBGYNs can get a baby out in 2 minutes once you've been put to sleep. Okay. 2 to 4 minutes. So those are resources you don't have at home. Now, let's say you are, I keep using my phone for when I can use this mirror up here. Let's say you're at home or let's say you deliver, and most babies will come out. So when there's a switch that occurs when you're born. It's God appointed, okay? So when the baby takes his first breath, the oxygen or the lungs expand, and then the airflow goes into the lungs, okay? This is something that does not. That's why you know, I always say babies don't breathe until they're born. So it takes that. So once they come out of the uterus, and that change in pressure from being in that tight uterus to coming out, the baby takes their first breath, and there's a switch in the oxygen that actually flows. That is a mechanism that usually is flawless, but it does not have to be flawless, okay? If it is not flawless, y'all, then you're going to need oxygen at birth. And that is something that your nurses and your doctors are NRP trained. We also have respiratory techs, and listen, when I tell you, my respiratory techs are the gods of the hospital. So they are going to be able to give supplemental oxygen. They're going to be able to do chest compressions. You normally don't have to make it that far. They have CPAP. They have suction where they can suction out, because sometimes you have amniotic fluid or meconium that gets in the baby's airway. They can suction that out. And I'm sure some of your midwives and things have those too. But let's say you get into a, listen, I just recently heard somebody say they had a breech delivery at home. Y'all, we could talk about that later. But anyway, so I'm at 15 minutes. This was my first video. I hope you gained something from that. Know that your babies, a lot of times, if they're less than 37 weeks, that's an absolute no. If you have diabetes, high blood pressure, if you are obese, y'all don't put yourself or your baby in jeopardy. Please have a relationship with a board certified OBGYN and have your baby in the hospital, because we have all the resources you need. All right, thank you. This is Dr. Stacie. Uteruses and cuteruses. I hope you enjoy my makeup putting on as well. It's very natural. I don't have on any foundation. Okay, y'all have a good day. Bye-bye.